Decoding Early Childhood Caries, Unveiling the Enigma of Nursing Caries Syndrome. Understanding Early Childhood Caries, ACC, a guide for parents and caregivers. Definition. Early childhood caries, or ECC for short, is a dental condition where young children develop cavities or tooth decay in their baby teeth. It's essential to recognize ECC early to prevent further dental problems. Patterns. ECC often follows a specific pattern, sometimes referred to as nursing bottle mouth caries, or nursing caries. This pattern typically affects certain teeth more severely, like the upper front teeth and molars. Surprisingly, the lower front teeth may be less affected. Some children may have extensive tooth decay that doesn't follow this typical pattern, known as rampant caries. It's essential to understand these patterns to provide the right treatment and care for children with ECC. Conclusion. Recognizing and understanding ECC is crucial for parents and caregivers. By knowing the signs and patterns of ECC, we can take steps to prevent it and ensure our children have healthy smiles for life. Let's work together to keep our little ones' teeth strong and cavity-free. Why lower incisors are spared in nursing caries. Explanation. When we talk about nursing caries, which is a specific type of tooth decay in young children, it's interesting to note that the lower front teeth, known as incisors, are often spared. This means they're less affected by decay compared to other teeth. Reasoning. This sparing of the lower incisors happens because when babies suckle, their tongue shields the lower teeth from the liquids they consume, like breast milk or formula. Additionally, saliva from glands under the tongue and jaw helps protect these teeth. In contrast, the upper front teeth are more exposed to foods when babies drink from bottles or feeders, making them more susceptible to decay. Factors contributing to early childhood caries, early childhood cavities, ACC, can affect young children, and understanding the factors contributing to it is crucial for prevention and treatment. Frequency of sugary drinks. One of the most significant factors in ACC is how often children consume sugary drinks. The more frequently they drink these beverages, the higher the risk of cavities. Bedtime bottle habits. Children with ECC often have a habit of using a bottle, especially at bedtime. This prolonged exposure to sugary liquids can increase the risk of tooth decay. Sleeping with bottles. Another risky behavior is falling asleep with a bottle mouth. During sleep, saliva production decreases, allowing sugars from the bottle to linger on the teeth and contribute to cavities. Other contributors. While bottle habits play a significant role, other factors may also contribute to ECC. These include issues like linear enamel defects, malnutrition, and hypomaturation enamel defects on second primary molars. Exploring the link between prolonged breastfeeding and early childhood cavities. The association between prolonged breastfeeding and early childhood cavities, ACC, has been subject to scrutiny, with circumstantial evidence suggesting a potential connection. Understanding this relationship is crucial for promoting oral health in children. Breast milk composition. Breast milk, comprising 7% lactose, is a significant component in the diet of infants. Prolonged and frequent breastfeeding, particularly during sleep, may contribute to ECC due to the sugar content in breast milk. Sleeping habits. Many affected children have a habit of sleeping with their parents and breastfeeding during the night, continuing beyond 2 years of age. These sleeping patterns and prolonged breastfeeding practices may heighten the risk of dental caries development. Timing of breastfeeding. While breastfeeding up to around 1 year of age is generally considered safe for dental health, prolonged on-demand feeding beyond this age may pose a risk for ECC, especially when associated with nighttime feedings. Cow's milk and ECC. Animal studies have shown that cow's milk, containing 4% lactose, may not be cariogenic. However, some clinical studies suggest a potential association between nighttime consumption of cow's milk bottle and ECC in certain children. Uncertainty. The role of cow's milk in contributing to dental caries remains uncertain and requires further investigation through robust clinical studies and research. Identifying preschool children in need of dental care. Importance of early identification. Early identification of dental caries is crucial for the success of preventive measures and restorative care. Some parents may mistakenly believe that dental checkups are not necessary until their child is 4 or 5 years old. Role of community dental service. Historically, the community dental service, formerly school dental service, in the UK provided dental screening in schools. This screening often identified untreated caries in children who had not yet had their first dental checkup. However, regular school screenings have been reduced in recent years, making early parental awareness more critical, encouraging early dental checkups for children. Importance of early dental care. It's important for parents to understand why taking their child for a dental checkup early is so important. As soon as a child's first teeth start to appear, usually between 6 to 12 months old, it's time to schedule that first dental visit. These early checkups are not just about fixing problems, but also about preventing them. Preventive advice. During these early visits, the dentist can provide valuable advice on how to clean the child's teeth properly, recommend the use of fluoride toothpaste, and discourage habits like drinking from a bottle for too long. By learning these good habits early on, children can keep their teeth healthy for years to come. Familiarizing with the dental environment. Introducing children to the dentist early helps them become comfortable with the experience. This not only reduces fear and anxiety, but also allows dentists to spot any potential issues, like cavities, before they become serious problems. Involvement of other health professionals. Health professionals like health visitors are also important in spreading the word about early dental care. They can share information with parents about the importance of dental checkups and how to maintain good oral hygiene practices. Guideline sources. There are guidelines provided by health organizations that offer valuable resources for both parents and health professionals. These guidelines help ensure that everyone is aware of the importance of early dental care and knows how to take action. Key recommendations. To sum up, here are the key recommendations. Encourage parents to take their child for a dental checkup as soon as their first teeth emerge, usually around 6 months of age. Work with local health professionals, such as health visitors and baby clinics, to spread information about the importance of early dental care. Utilize guidelines and resources provided by health organizations to enhance awareness and early intervention efforts. By following these recommendations, we can help ensure that children start off on the right foot when it comes to their dental health. Treatment strategies for early childhood caries in primary anterior teeth. The treatment of ECC in primary anterior teeth, particularly extensive decay in upper primary incisors, requires careful consideration of various factors to determine the most appropriate restoration technique. Strip crown technique. Indication, recommended for extensive decay in upper primary incisors where satisfactory cavities cannot be prepared for traditional restorations. Procedure, involves using celluloid crown forms and light-cured composite resin to restore the affected teeth effectively. Technique, trimming the crowns with sharp scissors, filling composite, and seating them on prepared and conditioned teeth. The celluloid crown form can be removed after curing the composite. Considerations, feasible under general anesthesia in young children due to the need for cooperation. Provides excellent restoration for primary incisors with extensive tissue loss due to caries or trauma. A. Carious primary incisors affected by dental caries, leading to decay and potential loss of tooth structure. B. Restored using strip crowns and composite resins to give an aesthetically pleasing result. The decayed primary incisors were restored using a combination of strip crowns and composite resin to achieve both functional and aesthetic restoration. The strip crowns were utilized to rebuild the damaged tooth structure, providing a durable and protective covering. Composite resins were then applied to the crowns to enhance aesthetics, mimicking the natural appearance of the teeth and ensuring a pleasing smile. This comprehensive restoration approach not only addresses the decay but also restores the natural appearance and function of the affected primary incisors, resulting in a satisfactory outcome for both the patient and the dental practitioner. Fractured incisal edges. Treatment, restore fractured incisal edges with composite resin. Purpose, restores function and aesthetics, preventing further damage and deterioration of affected teeth. Procedure, composite resin is applied to the fractured edges and shaped to restore the natural contour and appearance of the tooth. Benefits, provides a durable and aesthetically pleasing restoration, preserving the integrity and function of the affected teeth. Choice of restoration. Factors to consider, The choice of restoration depends on factors such as the child's cooperation, symptoms, extent of destruction, pupil assessment, and parental aspirations. New lesions in older children. New lesions on primary incisors in older children may indicate high caries activity. Restoration options include glass ionomer cement or composite resin. Glass ionomer cement, adhesive and releases fluoride but lacks translucency and may struggle with long-term retention. Composite resin, preferred if good moisture control is present, offering better aesthetics and retention over the term. Conclusion. Variability in treatment. Treatment of decay in primary anterior teeth varies based on the child's age, extent of decay, and cooperation. Consideration of factors. The choice between strip crowns, glass ionomer cement, and composite resin depends on various factors, including aesthetics, retention, and moisture control.